Have to ask you about the government shutdown, top of mind for a lot of Virginians right now. We have a lot of federal workers here. Any impacts they could see to their coverage because of the shutdown?
None whatsoever, Ashley. Medicare is one of those programs that both Democrats and Republicans love. It is funded. The checks are going out. Doctors are being paid. Hospitals as well. You'll get the care you need. Medicare Advantage, Medicare is the old-fashioned system. Just pays what bills come in. Medicare Advantage is an insurance-run system, but for the government. But both of these are healthy and kicking, and the open enrollment period is a reminder of that reality. And if you're thoughtful about the process, you can save hundreds of, maybe even thousands of dollars. But a little pro tip, Ashley, create your own account. That way, we know what medications you're on because we're paying, and what doctors you're seeing for the same reason. So you'll be able to figure out if the plan that you're on makes sense, or maybe you can save money by going to a different one. And we've been working hard with other federal employees to push down some of the costs. So some of the drug prices are actually lower this year, as are Medicare Advantage prices. So take advantage of those savings.
Absolutely. And speaking of savings, you know, of course, a hot button issue the past few weeks has been subsidies, and people saying, you know, I make too much to qualify for subsidies, but I'm still struggling to kind of afford my monthly premiums. Speak to those people. What options do they realistically have?
Well, if you're talking about the Obamacare subsidies, they're in their current form. They're funded through the end of the year. We need to have folks in the office here to be able to work out other systems. That is one thing I do think we should address with the shutdown. It doesn't really help us figure out better solutions for the American people if our federal employees aren't at work. So I'm praying the shutdown ends quickly. We can get people back in the office. But these insurance programs, and there are quite a few of them. There's also CHIP for children who are whose parents' income is not that high, and of course Medicare, which we're focused on today. These are all programs that are healthy programs. If we can just get people to use them in the right way and fund them appropriately, then we're going to protect these social safety net systems.
And of course, you know, for people that are kind of managing these chronic conditions, you know, diabetes and heart disease and things like that, you were talking about prescription drug prices. I know that's top of mind for a lot of people now that we're in open enrollment. Can you talk to those people who are concerned that perhaps their medication costs are going to explode in the new year? What do you say to them?
We're actually working hard to do just the opposite, to reduce the cost of these prescription medications. Many viewers have seen our announcements that in the Oval Office, we've had 3 now over the last 3 weeks where we've gotten the leading drug companies to reduce their prices. Actually, there's this crazy phenomenon where we pay 3 times more for the exact same prescription medications, same pills, same factory, in the same bottle, but we pay 3 times more than that same drug in Europe. So we're changing that. It's called most favored nation pricing, which means we get the best prices anyone in the world. The president insists on that. And so we've been accomplishing that goal, and we're going to continue to push down those prices. In fact, the medication prices on Medicare for Part D, which is the outpatient prescription program, that's actually coming down a little. Another good reason to go to Medicare.gov and compare costs, because you'll probably save some money depending on the medications you're on if you're thoughtful about the coverage that you're going to purchase or elect to have this year.
Absolutely. And then going back, of course, to Virginia, Hampton Roads specifically, again, we have this huge military presence here, this big federal workforce. A lot of people are concerned that, you know, if this shutdown drags on, there could be issues with reimbursements being delayed, perhaps federal programs like TRICARE, big issues with that as well. What do you say to the military and federal workforce that are concerned about how long this shutdown could drag on?
We're all concerned about the shutdown because it hurts our ability as federal employees to help the American people. But we have adequate funding for health care issues specifically. And the military has been protected. The president's so passionate, even about the salaries of military. If you're going to risk your life to protect our country, we're going to make sure you're compensated for that. But I'm still praying literally daily and hopeful that we'll figure a resolution out to this. There has to be some mechanism to get Democrats back into the game. I don't think anyone expected it to go even this long. But at some point, they'll wake up and smell the coffee.
Absolutely. Now, for just people in general, you know, a lot of folks have been kind of putting things off, with the open enrollment season, and they're concerned about, how to even get started. I know you mentioned at the beginning making sure that you have that account. But as far as protections for 2026, what do you need people to know, especially those that have been putting things off?
Well, there's some things you can put off in life and not be hurt. Putting off your health insurance is not one of them. This open enrollment period arms you with information and insights. Again, we worked hard with really thoughtful experts to improve the entire experience. But if you don't take the time to find the right insurance policy for yourself. Besides losing the opportunity to get the best coverage possible, you're wasting money. And God forbid you get sick and you don't have insurance coverage that's the right kind for you. You'll have to pay extra out of pocket, and it might not be with the right doctors because they might not be in the plan that you pick. So not deciding is deciding. This is the time in life to stand up and take care of yourself and get your family involved. If you're confused or intimidated by this information, sit with your spouse, a child, a grandchild, get somebody involved with you to look at all the opportunities and pick the things that make the most sense. It's really pretty easy to navigate. Make an account for yourself. And listen, if you're completely overwhelmed, there's no one to crutch on, just call 1-800-Medicare. These are thoughtful operators. They're all here in America. They're ready to take care of you. People care about you. And so they want to be there for you, so be there for them.
So lots of things to double check and to make sure you take care of during this open enrollment season. Dr. Oz, thank you so much for joining us this morning.
Thank you, Ashley. Stay well.